Good afternoon. My name is Suarez, and today I'm going to be talking about musical therapy and the promotion of the healing of individuals suffering from trauma and post-traumatic stress disorder. Listening to music has proven to be more than just an auditory experience. It also involves emotion and movement. Community musicking, the listening and production of music, is known to be a method of musical therapy in which helps greatly with the healing of trauma and post-traumatic stress disorder, PTSD. Musicking has been used in emotional healing practices from cultures all around the world, one of them being jazz funerals in the United States of America, specifically in New Orleans. In the short film, Big Daddy's Last Dance, the viewer can see how jazz funerals typically open with a brass band performing solemn marches, while friends and family walk along with the deceased to a burial. Then, the band starts playing more swinging and upbeat numbers, allowing mourners cathartic release in music and dance. Since this tradition can be considered community musicking, jazz funerals provide potential benefits for the emotional and psychological well-being of the mourners who are suffering from the traumatic loss. The treatment most typically used for trauma and PTSD is psychotherapy, especially cognitive behavior therapy, CBT, according to the Mayo Clinic. However, in the last 20 years, musicking has proved to be therapeutic for patients suffering from trauma and PTSD. This recent discovery begs the following question: to what extent does musical therapy help promote the healing of those suffering from trauma and post-traumatic stress disorder? Current research found that musical therapy, as a standalone treatment, has the potential to be as beneficial as cognitive behavior therapy for those patients who see music as a way of dialogue, free expression, and reconstruction of identity, and a safe place. According to the Mayo Clinic, trauma and PTSD may be caused by experiencing a life-threatening situation. These events may include personal threats to safety and seeing or learning about the death of a significant person in one's life. According to the McLean Institute of Harvard Medical School, as of 2020, 50 to 70% of adults in the United States have experienced at least one traumatic event in their lifetime, and up to 15% of these adults will then develop PTSD. However, PTSD is hard to recognize because of the related disorders that may come with suffering from it. These may include anxiety, depression, and insomnia. This leaves various patients suffering from PTSD to be inadequately treated, which brings emotional, physical, social, and economic burdens to the bear of this disorder. According to the journal PLOS ONE, psychotherapeutic methods do not address the content of the trauma that is encoded in the nonverbal memory. So music therapy as a nonverbal memory allows a person to recall the content of the trauma they could not have recalled by receiving only psychotherapeutic verbal therapy. The results of a 2010 study concluded that listening and playing along to different happy, psychologically chosen happy songs and pieces of music increased positive emotions as well as decreased negative emotions. In addition to this, the study argues that the hippocampus, which has a major role of learning and memory, plays an important role for the generation of tender positive emotions, such as happiness, and one of the great powers of music is to evoke hippocampal activity related to such emotions. PTSD has proven to reduce hippocampus activity, which is why there is an increment in negative emotions. Therefore, music therapy can potentially cause physical stimulation for the resurface of positive emotions in patients who suffer from trauma and PTSD, something not capable of happening through verbal therapy. Music can create a safe place for identifying the self, while at the same time creating a dialectic movement between pain that is connected to the traumatic experiences. This connects to the jazz funeral depicted in Big Daddy's Last Dance, where one can see the mourners crying, laughing, and dancing spontaneously while listening to the jazz band. The music allows mourners who are suffering from trauma to communicate their pain musically, using music to create a dialectic movement as a nonverbal emotional language. By starting the procession during jazz funerals with solemn marches, the slow tempo can induce relaxation, which then lessens anxiety. However, the more upbeat and swinging numbers that follow the solemn marches can assist individuals by de-escalating the intensity of their emotions, which causes emotional release and the potential de-escalation of the pain mourners are feeling. In addition to this, musicking has been proven to have therapeutic and healing qualities, even when conducted outside of a formal therapeutic setting. A funeral, non-traditionally a formal therapeutic setting, can become a therapeutic setting for mourners and therefore form part of community musicking. Despite musical therapy having beneficial effects on many of those who have suffered from trauma and PTSD, a systematic review published in 2016 stated that when it comes to school-based social emotional interventions for refugee and war-traumatized youth, creative expression methods and cognitive behavior therapy were separately tried to improve social emotional functioning and mental health in young refugees. The researchers found that musical therapy had a negative effect in particular, and the use of creative expression therapy in all of its forms gave inconsistent results since their effectiveness is subjective to the patient, while CBT was the most consistent in positive results. In other words, musical therapy is subjective because not everyone has the same connection to music as others do. Therefore, currently, musical therapy is subjectively beneficial. More research that focuses on music therapy as standalone treatment should be conducted to prove that musical therapy could be as beneficial as standalone psychotherapy on individuals who create a connection to music. In addition to this, more research that focuses on musical therapy and CBT as a combination should also be conducted since CBT is the most effective form and musical therapy can treat the content of trauma that CBT cannot treat. Thank you.